People are waking up to the fact, hey, this doesn't all seem right to me. The average person that was in the dark seems like they're more open to hearing more about the root cause than just fix my pain, doc.
My name is Michael Rubino.
I'm on a personal mission to make sure you don't get sick inside your own home.
I knew there was something wrong. I'm just so relieved there's something that you can do about it.
Thank you for joining us for another episode of Never Been Sicker. I'm your host, indoor air quality expert, Michael Rubino. And today's very special guest, Dr. Phil Straw. Dr. Phil Straw, thanks for taking time.
Thanks for having me here, Michael. It's great to be here.
So the podcast is called Never Been Sicker. And this is really because, statistically speaking, we really have never been sicker than we are today.
Yeah.
I mean, I saw it was like a 19% increase in adults on prescription medication just over the last couple of years to like almost 79% of adults on prescription medication. Chronic illness and chronic disease is on the rise. So what are your thoughts regarding that?
You know what? You're preaching to the choir right now. It's crazy to think about. When I got in this profession of helping people get their health back, the number of fundamental problem with it wasn't as much. It started with their mindset, right? They've been indoctrinated since they're young that if they have an ailment, they have a symptom, there's a pill for the solution. And so people have been chasing after a cure, a pill outside of themselves to find their health. And I think it's fundamentally, it's a mindset problem, and it's started with, I hate to say it, like be one of the next guys that say it, but big pharma, the big institutional medicine, pushing their agenda of having lifetime customers on medication that doesn't treat the root cause. Yeah. So it's a root cause problem.
Well, I sure don't hate to say it because I feel like it for sure is this thing that continues to come up. Every time, this subject arises, it's about big pharma and the just how medicine is really transformed to this pill for every ill.
That's right.
And obviously that's how the whole thing is incentivized. I mean, if you typically are looking for where the incentives go, you'll find where the problems lie. And so, you've been through medical school?
I'm a chiropractor, actually.
Okay.
Yeah, and through that, it's interesting, right? So you think a chiropractor is working with patients structurally to find the cause of their pain. And so whether it's a physical, it's a back problem, or if it's a nerve problem, it's the cause of it's never lack of a pill. The reason that lady came in to see me last week wasn't because she thought she was having these headaches. She goes, when I take Advil, it goes away. And so she, in her mind, she has a deficiency of Advil. She just needs to keep taking pills. But
right.
There's an underlying cause to all these ailments that people, thankfully, I don't know if you agree with me, but I think in the last several years, people are starting to wake up a little bit. With the things we went through in 2020, people are waking up to the fact, hey, this doesn't all seem right to me. So the average person that was in the dark seems like they're more open to hearing more about the root cause than just fix my pain, doc. Right?
Yeah. No, I'd agree with you 100%. I feel like a lot of people are waking up. I mean, I see it not only in social media, but I see it when I talk to people.
Yeah.
They want to know what's going on with them and what's the root cause of that. And in my profession in indoor air quality, we're helping people address root cause of their homes and why there's issues going on in their homes. And we see such correlation between what's going on in their homes and what's going on in their bodies. As a matter of fact, we have a test that helps them correlate what's going on in their home, what's going on in their body, which is crazy.
You say that, and it's like it's their environment, right? And the environment includes, what they put in their body, right? What they eat, consume, and then the environment they live in. And
Right.
so we'll see patients, like one of our main things that we've been very successful in treating is people with nerve damage, usually in their feet or their hands, and it's called peripheral neuropathy. And one of the big causes of it is they don't realize they have an underlying autoimmune condition. And one of the things that can trigger that is like environmental, right? So in their house, if they're exposed to mold, for example, and they don't know it, that can trigger an autoimmune response, which makes their whole body attack their own nerves.
Right.
And so they go through all these different things, and ultimately they come to see us. The doctor says that their main provider tells them there's nothing they can do for it. They have to live with it, and it's going to get worse. But if you look under the hood and you're willing to do the work, you can find out there's a cause to just about everything. And so some of the times the cause is autoimmune conditions, either from food or environment like mold or deficiencies in different vitamins, the things that they have that their bodies lack in. So it's fun to actually get to the root cause and actually get someone and help them bring their health back.
Totally. Yeah, I can't imagine that. I mean, there's so much obviously awareness around root cause medicine,
Yeah.
which is really cool.
Mm-hmm.
But prior to that, we had this pill for every ill issue,
Sure.
obviously. And of course, that creates that mindset shift that's needed. I would say the growing awareness has been really positive, but of course, we're still talking about a small percentage of people.
It's true. It's true. And you say pill for every ill, and then what happens when the pill doesn't work? Well, we have a scalpel. That's the next thing. We can do surgery. Let's cut that thing out. You must not need it. If it's
Right.
causing all this pain, let's remove that body part, basically. And I mean, and that's what happens. I mean, right now I'm thinking about a condition that over 90 million Americans have, and they often don't talk about it. And it's actually a nerve and muscle condition, but you wouldn't know it. And the condition is incontinence. Basically, either postpartum after having babies, or later in life, there's a big chance that you're going to end up having incontinence later in life. And when I say incontinence, I don't mean like, you think of someone that just pees on themselves all the time. What incontinence really means is they lose control to go to, to either go to the bathroom when they want to, or they have to go all the time, basically. So there's two types: stress incontinence and there's urge incontinence. And the reason I mention that is because that can happen from nerve damage, right? So again, back to the root cause. Why aren't their nerves working right? Did they have any autoimmune condition? Have they been exposed to something in the environment that's triggered that? And there's other reasons than just here's a pill for your incontinence, and you never guess what. If the pill doesn't work, what do you think they tell them to do next?
Surgery, I guess, is usually the next step, right?
It is, but before they do that, I kind of, to be honest, there is one other intervention, and it's a $5 billion a year industry: adult diapers and pads.
Oh, wow.
So if the pills don't work, try these pads, wear a diaper, and you'll see celebrities on TV that don't look like they have incontinence, but they're telling you that, hey, these are the diapers I use. And so that's what we're dealing with. Those are the kind of solutions. You talk about Band-Aid solutions. I mean,
Wow.
And so if you're able to get to the root cause, and like in your business, you're helping people remediate the environment of their house and keep that an environment that promotes health, and versus pushing their body into the symptom category and
Right.
degrading their health. If you're able to do that and get them to eat right and educate them on that and take the supplements they need to do and get exercise, it's amazing how the human body's designed to get better and cure itself. And I said the word cure, that's another taboo word, but actually heal itself, right?
Yeah. Well, I couldn't agree more. I mean,
Yeah.
I remember being a kid and like falling down and getting hurt, and in like 2 days, like you wouldn't even know. Like the kids bounce back so great. And
You probably thought it was a Band-Aid that got you better.
you might be right.
Yeah.
As a kid, I might have thought like that little, kiss on the knee and a Band-Aid. That's it. That's all I needed. But, it's true though. Like, the human body's amazing. It bounces back. I mean, broken
really
bones
does.
get healed, right? I mean, like it does heal itself. And even like the autoimmune conditions and MCAS, where, essentially you're attacking yourself.
Yes.
I mean, that's your body's trying to heal. I mean, that's why it's happening that way. And it's just a little bit confused, typically due to environmental triggers.
That's right.
But, it's amazing how like magical this vessel really is.
There's hope out there, though. I can remember, I'm not only treat patients, but I've been a patient, and I went and saw a naturopath just to do an overall health evaluation. And first thing she did was, hey, let's check out your environment. Let's do a mold test at your house. Let's make sure there's nothing like that's adding to, any of your symptoms you're having. I was like, that made sense. Let's do it, right? So you think there's hope, right? There's more and more people open their eyes.
Yeah.
They're not satisfied for the 5-minute doctor visit, and here's a prescription. They're like, Doc, can we go over my blood work? I mean, you just ran these tests on me. Do we have time to actually go over it,
Yeah. How long ago did you start to realize that like mold exposure was a part of the picture?
You know what? I think in the last 10 years, it's just with patients and their own experiences coming into my office, we go down the rabbit hole with them as far as, okay, we run these different tests to see if they have peripheral, what could be a trigger of peripheral neuropathy, for example, and you're coming up, nothing, the blood sugar's okay, they're not pre-diabetic. I mean, those are like the common causes, for example. And then you see some of these autoimmune triggers, and you're like, hey, well, is it gluten? For example, is it gluten, or is it, do they have a mold issue? And it's not until you go and dig deeper that you see that some of these people do suffer with those types of things.
Yeah.
Even people without a background of having, they can't tell you they had a flood in their house. They just somehow they got exposed to mold anyways,
Yeah, no, it's crazy. I mean, obviously, there's so many different ways they get
Yeah.
exposed in their home. Maybe they bought a house and there was flood damage before they didn't know, right?
Yeah.
All these types of things that occur. But it's interesting because I actually had no idea that mold was a problem.
Yeah.
Until 2012,
Okay.
Hurricane Sandy hits the Northeast. I started to see a pattern of people getting sick.
Mm-hmm.
And the strangest thing for me was like there was all different types of illnesses. So like people had MCAS or mast cell activation syndrome, but then the mold was triggering certain symptoms.
Yeah.
Lyme disease. All of a sudden, like I started to see people with Lyme disease get sicker
Yep.
from their environment. Epstein-Barr virus, reactivated Epstein-Barr virus. I had someone who was so sensitive to their environment, they had to get rid of all microwaves. They couldn't be around cell phones. All their computers were hardwired. And she was showing me pictures, like Polaroid pictures of like her skin being red and like almost looking like there were burns when she was near, low level frequencies of EMFs that most people tolerate totally fine. And so it started to open my eyes like, wow, there's something here that is worth really exploring. And that's kind of how this whole career started. It was just this, I just took an interest in people and their pain and suffering and what could I do to help alleviate that? And to me, now I see this huge world of how it impacts just like chronic illness, longevity. I've seen now infertility on the rise and seeing a correlation with mold exposure on that. Like, it's pretty interesting. And the reason I asked is because when I was in 2012, 14 years ago, people thought I was nuts.
Mm-hmm. When somebody comes in with a profile like the patient you just described, they've been dismissed by so many doctors before they got to an alternative provider's office. You feel so bad for them because people basically tell them they're crazy, right?
Yeah.
There's nothing you can really do. Take these antidepressants, right?
Literally, and that's what happens today, and it's the craziest thing because, obviously we learned about anxiety and depression.
Sure.
Those symptoms being triggered by their environment. And so, I get it. Like they're having issues.
Mm-hmm.
So the normal one thing that people want to do is then go back to that ill for the pill mentality of like, oh, we'll take this pill and that'll solve your problems. I have a client right now who's on these anxiety medication. I'm trying to tell her like, hey, I'm not a doctor, but if it's not working, you need to speak up.
Sure.
If this isn't working and your symptoms are being triggered by your environment and the pill is not doing anything for you and it's actually making the problem worse, you need to like speak up, and come make a decision on what's best for you and your family. Cause, we know that these drugs are very harmful, especially to somebody who doesn't need them and isn't responding to the medication. So it's really looking at it from this perspective of like, we got to get off this mentality as you mentioned, because if we're not addressing the root cause and we're just putting Band-Aids on everything, well, we're not going to be happy. We're not going to feel better because we're just masking the symptoms. And the symptom we have to remember is like, there's something underlying that is causing that symptom. Right.
Exactly.
And if we're not addressing that, what are we doing?
Yeah. So back to the root cause, right? What are we doing to get to the root cause? Well, you better start with a thorough evaluation of how the body's working. And it consists more than just standard blood work, right? You got to do a more comprehensive blood work and then different environmental tests too. You got to take the whole picture and to really make a good evaluation of the patient and then to give the recommendations. And the good news is like back to it, instead of every pill for every ill, people are opening their eyes. And so, forums like this, you get the word out and people hopefully will, you'll save another person.
Yeah. I never expected to be like this anti-pharma guy. It's not really, it just started to happen organically because you start looking. Yeah. And as you look, you don't really like what you see.
That's right.
And it's like when I got into this industry, I was really an anti-industry standards guy.
Yeah.
Because when I looked, the standards weren't helping people. Mm-hmm. And unfortunately you had people that weren't even adhering to the basic standards. So that was a problem. But then the standards themselves were leaving a whole underserved population behind. So I became, sort of the anti-standards guy. And now I'm becoming sort of the anti-big pharma guy because, as I'm looking and I'm seeing, the issue here is that people aren't getting better. I mean, how long are we going to sit here and say, with advancements in medicine, with advancements in technology, we are never sicker than we are today? How does that make sense? And obviously it only makes sense if we're not addressing the root cause.
That's right.
Because if we were, the numbers would be getting better.
And then if you just look at other countries, right? It's like, why don't they have why isn't heart disease the number one killer in the rate of heart disease in Japan or Hong Kong or or go to Norway? I mean, they don't have the same problems we do. It's like, what's the difference, right? It's the nutrition, it's the intervention. It's just we like to isolate ourselves. Well, this is how it is. We're the best. We have the best healthcare system in the world in America, but based on what? I mean, we have the best emergency care. We'll keep you alive if you get in an accident. But as far as healthcare, health promotion, the name of your podcast is, never been sicker, right? I mean, that's the case for America. Even with advancements in pharmaceuticals, I mean, still heart disease is killing more people here than anywhere else, right? I mean, it's amazing.
Yeah. And something's got to change, right?
Yeah.
If we don't change our behavior, or we continue to go down this path, what world are we going to have left behind us? I mean, I see how this translates into the built environment too, quite a bit, because our homes have never been tighter than ever. We had that global energy crisis when Richard Nixon was president in the 70s. So we started going all on this warpath for energy efficiency. Tight, no air exchange. Let's keep the cold and...
Dude, it's crazy in these office buildings, right? I mean, you can't open the window, right? How do you get any fresh air? It's like this.
You can't.
And you can. So what's pumping through your AC system, right?
A lot of particles, a lot of microbes.
And you talk about standards. I mean, that's a place where they need to increase the standard, right? So they start testing for this stuff on a regular basis, and they don't do it, as far as I understand, unless you request it. It's not going to happen.
No, and again, it's all geared towards energy efficiency, like LEEDs. You ever travel around, you see these big plaques on these buildings that are proudly to present LEEDs, which is like an energy efficiency standard.
Okay.
It's the gold standard for energy efficiency. However, it has very little to do with environmental toxicants inside these buildings.
They're not even testing for it, right?
Not only are they not testing for them, I went to Hawaii recently.
Yeah.
Okay. I had to go visit a client and go look at a project. And one of the hotels that I had dinner at was a Leeds hotel. And I walk in and I smelled mold in this very fancy high-end hotel. Just literally walking in the door. I get it. It's Hawaii. You can say like, oh, that should be expected. It doesn't need to be expected.
Yeah.
And I live in Florida. It's very humid here too. When you walk into my house, you don't get smacked in the face with mold, right? Mm-hmm. So I was surprised to see this building get smacked in the face with mold. However, I also understanding that LEEDs is really more for energy efficiency. I do understand that, unfortunately, air quality is not like at the top of the horizon here, as it should be. What's interesting to me is we're abandoning human health for energy efficiency. Mm-hmm. Why would we do that? We should be prioritizing human health. And energy efficiency should just be responsible energy efficiency, not like the.
I mean, it's interesting what you're saying. It's like it's up to. So, fortunately, people like you are waking up the public to you understand. It's more about that's not just about energy. It's about energy and health, and how they don't always match up together.
No.
So that makes a lot of sense.
Yeah, you pointed out the nutrition obviously needs to be fixed. Mm-hmm. I mean, our food needs improvement, for lack of a better word. Food choices
sometimes. The good food's there. You just got to choose it, right?
Yeah, right. Air quality is not where it needs to be.
Yep.
Medicine, obviously, this whole reliance on taking pills, obviously a problem. If we look at all these different pieces, people aren't moving enough, right?
Yeah.
They're too sick to move.
Mm-hmm.
I mean, to be blunt. I talk to a lot of people. I'm sure you talk to a lot of people. I mean, they're in pain, right?
Yeah.
They're not feeling well. If you're not feeling well and if you're in pain, how well are you moving?
You're not moving. If you have a chronic inflammation, they blame it on I got arthritis in my knee, but it's really it's because their diet is causing systemic chronic inflammation, and maybe their environment is too, and now they're not moving, right? It's like clean up your diet, clean up your environment. Maybe those knees aren't going to hurt so much. You'll be able to start moving your body. And everybody wants to be a victim, but you have to realize that if you take charge of your own health, then you can get to the root cause, or at least towards it, right? You can make steps in that direction. And I think that's empowering, right? I mean, when people realize that they have to go. And sometimes you think about medicine, it's almost like it's like a religion, right? You got to go to the priest to find out what's wrong with you, and then he's going to prescribe you to do something or to take something, and you'll be better. And they don't really question it. The frustrating part is dealing with the older population, right? And the way it really lines up, they have the most chronic conditions. But when you talk to somebody older, they're more in line to really follow whatever the doctor says without questioning it. They're not going to go home and maybe Google it and maybe find some questions to ask, follow-up questions. They're just going to say, the doctor said to take this pill. I stopped taking this pill, I've had someone tell me, if I stop taking my blood thinners, I'll be dead in 3 days. I mean, that's how much fear they have about the medicine they take.
Well, somebody must have told them that.
Exactly. And so, the fortunate thing is people get, that mindset kind of goes on with the next with that generation. So the hope is, I think, educating the current, the younger generation, and that's when a change happens.
Yeah. So I want to talk about neuropathy for a minute, just
Yeah.
because it's not something that I get to talk about every day.
Sure.
And, this is something you specialize in. And can you give us a lay of the land? First off, for those listening, what is neuropathy?
Sure. Neuropathy is when you have nerve damage. And usually if there's a word in front of neuropathy, peripheral neuropathy, this basically means in your legs or your arms, hands or your feet. And it's when you get nerve damage in those areas. And when I say nerve damage, the symptoms, again, people come in because of symptoms, right? So they're either having tingling in their feet and toes, burning in their feet or toes. Typically, it starts down there. It starts the furthest away from your heart, which would be your feet and toes. And it starts there because your circulation diminishes down there. And it either diminishes from metabolic problems, like higher blood sugar from a poor diet, autoimmune, like we talked about, structural problems. But they'll typically feel the symptoms in their feet or toes first. And sometimes it can be burning, keeps them up at night. And then it also affects their balance eventually. So they can't feel steady on their feet. And you add all those things up, I mean, it's a miserable life. And eventually, again, what happens with that patient is they go to the doctor. And the doctor says, you have to live with it. There's nothing you can do. But if the pain's intolerable, here's a pill for that, which is basically an anti-seizure medication that slows your brain down so you don't think about your feet. I mean, that's the approach. So when you get to the root cause of that, by improving their metabolism, increasing the circulation in their feet, and doing things that help the nerve flow, people actually get better. It's amazing, right? What happens when you do things like that? But what's crazy is people relate to the feet. That's usually what it brings them in, because they're not able to sleep well. They're not able to do the things they want to do. And eventually they'll lose their independence in a lot of cases because they don't have good balance. And and I don't think I mentioned, that's like about 22 million people in the country suffer with it. But nerves go to a lot of other places besides your extremities, right? It goes to your heart, it runs your heart, your digestive system, your sexual function. And what happens is those nerves start to get damaged too over time. And we talked about incontinence earlier. It can affect the nerves can affect your pelvic floor muscles that keep you continent. It can affect the bladder, so the communication from your brain to your bladder. And when that happens, they're not able to control and stay continent, right? And then it can affect their sexual function. So it's all a cascade of problems that start with a little tingling. They think it's just a little tingling in their toes, but since it's progressive, degenerative, over time, it starts working its way up through the body.
So it obviously gets worse over time, not better, unless they're actually taking steps to fix it.
Fix the root cause, right? Yeah. Versus taking medication and not thinking about it, ignoring it.
Right.
And it's just one of those things that come with aging for most people. Most people are going to be in their 50s or older before they experience that. And if they don't handle it, it becomes to the point where the cascade of additional symptoms, and eventually it can lead to amputations. It's a real reality, and it comes back to not taking care of the root cause of of their health.
I want to talk to you about some of your patients. You know, they come to you with this tingling, right? That's where it starts. They come to you because there's a symptom and they're looking for help. And, you know, I'm curious, what is their mindset typically like? Do you have to kind of do a lot of coaching with them to get them to understand that root cause is what you're going for, and that there's not just going to be a magic switch that turns things on and off?
That is a critical part. Like in the beginning of our conversation, I talked about the mindset of the patient, right? It's like you got to change the mindset before you change their behavior. And so if I want their behavior to come in my office and for a series of visits for treatment, they have to understand what's going on. So patient education is critical. And we go through a process where, you know, they either come to one of my lectures or we'll do one-on-one coaching with them so they understand. We want them to understand in layman's terms the physiology of the body so it makes sense why they have this condition. And then once they understand that, the way we treat it makes even more sense. And they look at that bottle of pills that their doctor gave them, they go, this doesn't make any sense to me, and they're eventually going to throw those away. It's critical that you have the patient education part, or else they're not going to get the outcome that they're looking to get.
And the reason I ask you is because, you know, when I talk to other doctors, you know, they say some of the issues within the medical community itself is doctors just don't have time to educate patients.
Yes. So the reason they don't have time is because they're on these insurance plans where they have to see so many patients per hour to get paid. And so they work it out. They have like 3 to 5 minutes to see a patient, right? And it gets to be this rat race where they're just seeing more and more patients. And in my world, in alternative provider world, we're not going through the insurance model. We have a relationship with the patient. We want them to get the result they're looking for. So we're willing to take the time that's needed to both consult with them, to diagnose them, and to treat them. So it's a completely different situation. And what's interesting is when we really first got momentum with this neuropathy treatment, we know where are most of those patients. Most of those patients are in their main provider's office complaining about, you know, their general practitioner, and they're being managed not very well. And so I thought, hey, let's go talk to them and educate the providers about the options for peripheral neuropathy treatment. And when we went to do that, we had we took our time. We had a really nice presentation. We'd bring them lunch, you know, get their staff in the room and have a chance to present with them what we do. And then, you know what? They were really interested, and they were like, this is great. I'm really, you know, this makes sense that this could help my patients because I really can't do anything for them. In fact, it's a symptom that when a patient comes in to see their general provider, they don't usually just have one complaint, right? They have a series of conditions. They might have heart disease, diabetes, and then they have high blood pressure and maybe neuropathy. Well, the doctor's real comfortable about talking about the heart disease, the high blood pressure. They'll handle that with the prescriptions, but when it comes down to neuropathy, like, that's last on the list. My point is, when we went to educate those doctors, they were interested, like, hey, if you can help my patients, that's great. But then came the toughest question at the end of that. The final question was, does insurance cover this? And when we said no, the doctor's face and his office manager, they just kind of, like, our patients won't pay that. Our patients won't pay for care. We have trouble getting our copay from the patient. So the doctor's mindset is patients will only pay for standard of care, which is what insurance covers. And so they suffer with the same mindset as patients, thinking our system will only pay for, there's a pill for every ill type philosophy. And their practices are, for the most part, limited to that. And they don't even want to try to attempt to bridge it and give them a referral. For the most part, there's exceptions to an alternative provider that can get to the root cause. Because in their mind there's no way, if my patient won't pay me $10 for a copay, they're not going to pay this doctor, you know, a substantial investment sometimes to get better. You know, it's super interesting how the psychology of how that works with the patient-doctor relationship and standard of care versus alternative care.
I mean, it's crazy to think about. Like, the whole system is broken.
Yeah.
Because that's like we're relying on the insurance companies to get anything done. They basically don't want to pay.
They don't want to pay.
So that gives you very limited treatments.
And so even the doctors that are in the standard of care, they're complaining because they're getting less and less pay. And then the patients are complaining because their premiums are going up every year, right? And so the only person winning on this is that I can see is the insurance companies. They're getting bigger premiums, and the big pharma that's getting their drugs paid for, right? It's like everybody else is getting squeezed. But I think, it's a bigger conversation, but could you imagine if they didn't have any health insurance? We just like fee for service and let basic economics work its way out in the marketplace of healthcare. It'd be amazing, right? Over time, it would all work out, and we wouldn't need.
It always does.
Yeah.
I mean, cars are expensive. Everybody has a car.
That's right.
I mean, everybody has a place to live, you know?
There's no magic fairy paying for that.
I mean, it's you think about the basic economics of it all, a human being will figure out what it needs to figure out.
Yeah.
You know, it's just that there's some customs here and some belief systems worked out, and where everybody's kind of dependent on these insurance companies, and you pay them so damn much, you almost think everything should be covered. I don't blame anybody for that. I mean, you know, I think I spend like $3,000 a month in health coverage for a family plan,
whether you go or not.
whether I go or not.
And then if you do go, you got a deductible on top of that.
That's right.
It's like,
I think last time I went to the doctor was over a year ago.
okay.
Because that was like
Yeah.
when I was sick or whatever and had to go or whatever the reason was.
Sure.
But, you know, it's like I don't utilize that plan. But of course, I'm happy I have it if I had a catastrophic event and I needed a
That's what
$500,000 surgery or something.
That makes
right?
sense, right? Like
Yeah.
catastrophic insurance, but the wellness, the taking care of yourself, the seeing a provider proactively to make sure you're on the right track. I mean, it makes sense to me. That should be out of pocket, to be honest.
But it's like the whole system, if you look at it, it just doesn't, it's not designed in the right manner.
Yeah.
And I deal with this on the mold side. Like the home insurance parallel is it's so fitting for what we're talking about,
Okay.
because if you have a insurance loss, basically they'll cover up to $10,000 of mold remediation if you have that part of your coverage, which over the years they've just strategically taken it away from people without people knowing. And so there are people that call up and they're like, hey, do you take insurance? And I'm like, well, I mean, do you have insurance? Yeah, I've got insurance. Here's my policy. You have no mold coverage. I can't help you if you don't have coverage.
Yeah.
But they don't know that they don't have coverage. Right?
Sure.
And so strategically that's designed to not pay for things properly. And as the standards started to improve, as people like me wanted to, really improve the standard of care in people's homes and scientifically really eradicate whatever happened in their home and be able to prove that, well, they don't want to pay for that. And as long as you have these big box companies that'll come out and cut 2 feet off the bottom of the floor, and say that that's all that needs to be done, even though like real analysis shows you that that's not the case. That they're fine to get away with that. And it's like, for me, I now have to basically take cash out of pocket and not accept insurance because my own integrity of doing it properly and getting people the standard of care they actually need.
Yes.
Need and deserve, but not just because we want to take insurance and give them a BS product, but a real product. I mean, that's really a big part of the puzzle. I see the parallels there. Like the insurance companies are part of the problem.
It's crazy, the parallels, right?
Yeah.
You know what's amazing though? I'm sure you can relate to this. When you do get a client that will invest in their home environment and follow your recommendations, I mean, they're a great client, right? They really appreciate what you do, and they're a motivated client, right? They want to do everything they can so they can have a healthy family and house environment. I mean, it's the same thing with a patient that comes to see us that knows their insurance won't pay for it. You just need, that mindset is so important. Those patients, that client obviously has a mindset to take responsibility for their health, and that's kind of like, again, back to the root cause. We got to change the thinking of America. Like take charge of your health, take charge of your home environment. That you can have it all if you're willing to invest in yourself and do what it takes, not be a victim of some third party payer, whether they're going to pay or not pay.
If somebody's watching this podcast and they're wondering about the mindset shift that they need to make, that leap that they're going to need to make, what advice would you have for them?
I think back to what we talked about in the beginning is just realize your body, despite what people may have told you, your body can heal itself. Your body can get healthier than it is right now if you feed it the right nutrients, if you do the right therapies. But I mean, if you do need therapy, any kind of intervention, and it's designed to heal itself. And humans have been around a long time without guys in white coats to take care of you. And I think that you just have to really take the time and make sure it makes sense to you, whatever recommendation is given to you. Is that really the root cause, or is that just masking of symptoms? And the great thing now, right, there's so much information available. If you do get prescribed something, you can take a look. Does it make sense? Is this going to really help you? Maybe you do need an antibiotic. You do have you have an infection, take it. But is it just a painkiller to mask the symptom? Get to the root cause.
Yeah, despite what people believe, we cannot have Tylenol deficiencies.
That's right. That's right.
So going back, just thinking about like the whole ecosystem and how things are designed, thinking about how you see patients and how you're looking for root cause. Obviously, you've mentioned a couple, but just anything else we need to think about in terms of what are the typical root causes that people are running into when they're dealing with neuropathy?
Sure. I think that this could be for neuropathy. This could be for a heart disease. It could be for high blood pressure, high cholesterol, all these different things people have. It's sound like a broken record, but I'm going to keep saying it until people make the change. It's like you got to take a look at what you're putting in your body. We're putting all the highly refined processed foods are just causing inflammation. And if you have inflammation in your body, it's going to express itself in some kind of symptom, whether it's, like you said earlier, a rash, an achy joint, a high blood pressure. It's going to affect you. You can't get away with it. So the more you go back to the way we ate, 100 years ago, I think your body's going to appreciate that, and it's going to reward you with having better sleep, better energy, better vitality. And it's really simple as that.
Yeah. So true. I find that most things worth checking out in life are pretty simple, actually. And most of the complexities you want to just throw away.
That's a good point. I agree. I agree.
So I always like to ask two questions specifically. And, one of them is just talking about, like, from your personal experience, what's sort of the biggest lie that you've encountered that you've really been able to overcome by just looking and really finding the right answers?
That your genes are your destiny. People for so long, doctors have been telling people, well, it's in you. You have breast cancer. It's in your mom had breast cancer. It's genetics. Your dad had a heart attack. You're going to have a heart attack. It's genetics. It's basically it's fatalistic belief in your health and your future based on your genetics. And the truth is, as time goes on, we've learned that basically the best analogy I heard was, genetics. You might have bad genetics in certain areas. I mean, I can relate to this. I have what they call an APOE4 gene, which makes me more likely to get Alzheimer's, right? And but the truth is, it's like that's just one piece of the puzzle. There's so many other factors that influence your long-term in your health and your longevity. But specifically, the genes load the gun, but your environment pulls the trigger, right? So no matter if you have bad genes or not, if you do all the right healthy things in your environment, and whether that's your house and the services you provide or your exercise and your diet, you can counteract those genetics for the most part. And that's scientific fact now. They know that. But unfortunately, most people are still going around saying, oh, it's my genetics. I got bad genetics. My dad died of a heart attack, so I'm going to get a heart attack. My grandpa had cancer. I'm going to get cancer. But no, you have more control than that.
Yeah. Next time someone says they have bad genes, we'll comment on their pants instead.
There you go.
Break the cycle.
I like it. I like
that. Must be those genes you're talking about. No, those genes look great on you.
Yes, yeah. I like it.
Good. And then the next question that I always like to ask is really just on controversies, because controversies, they're typically fun because there's always a little bit of truth in them. Mm-hmm. And you typically see them get spread and spread like wildfire. And so what are one of the controversies that you've run into that actually had some truth in it?
Wow, that's a great question. I think one of the controversies right now is people think that the new weight loss medication, right? The Ozempics. I mean, go for a lot of semaglutide, other brands. That's the answer to having normal weight and being healthy. And I think it's controversial because I don't think it's true. I mean, it might help somebody get over the hump, and it can help certain people, but I think it's such a problem. There's so many people taking it just to maintain a healthy weight that I think we're going to see in 5 or 10 years some crazy side effects that no one really anticipated.
Yeah. I mean, that's right. We don't know all the potential side effects that it could have.
I mean, the amount of money that drug's making right now is ridiculous, right? And all the knockoffs from it. I mean,
I'm sure
it's amazing.
it's not exactly cheap, is it?
No. We'll see how that plays out.
We'll see how that plays out.
Yeah.
Well, I really wanted to thank you for being here today, taking time out of your busy day, being here with us and sharing your stories. And, obviously the information you share is really important. And I think it's a couple of things. One, the big takeaways for me is we need mindset shifts. I couldn't agree more.
Yeah.
Learning more about neuropathy
Yeah.
was really important. And I think how the environment plays such an important role in that, I think, is also really important because, I've definitely had consultations with people and they're complaining about balance, tingling, frequent urination. And so, there's going to be people listening to this that are going to register, oh my goodness, I need to pay attention to my environment. I need to look at the food I'm eating, do a little life audit, if you will.
Absolutely.
So I think it was really helpful. And I know you're going to impact so many people just by the words you've spoken today and everything you've shared with us.
I appreciate it.
So we'll definitely have you on again soon and continue to keep up with you and all your amazing work. So thank you.
All right. Thanks, Michael.
And thank you for joining us for another episode of Never Been Sicker. I'm your host, indoor air quality expert Michael Rubino. And until next time.